Question 1. What is the primary role of an RBT in the behavior change process? A. To design behavior intervention plans. B. To implement behavior intervention plans developed by a BCBA. C. To diagnose developmental disabilities. D. To conduct functional analyses. Answer: B. To implement behavior intervention plans developed by a BCBA. This question is asking about your main job as an RBT. The keyword primary role tells you to look for the most important responsibility, while BCBAs, board-certified behavior analysts, are the ones who create the complex behavior plans. The RBT's crucial job is to follow those plans directly with the client. RBTs work hands-on, putting the plan into action as instructed. You don't create the plan, diagnose conditions, or do complex functional analyses. You carry out the instructions given to you. For example, if the plan says to prompt a client to ask for a toy, you are the one who will do the prompting. Here's an easy way to remember it. RBTs are the boots on the ground, putting the expert's plan into practice. Question 2. When measuring frequency of a behavior, what are you counting? A. How long the behavior lasts. B. How many times the behavior happens. C. The time between behaviors. D. The time from a signal to the start of the behavior. Answer: B. How many times the behavior happens. This question is about measuring behavior using frequency. The keyword frequency is the key clue here. As in everyday language, frequency means how often something occurs. When you measure frequency, you are literally putting a tally mark down each time the behavior happens within a specific observation period. It's a simple count of occurrences. It's not about how long it lasts, that's duration, or the timing between events, that's interresponse time or latency. For example, if a client claps their hands, you count each individual clap as one occurrence. Here's a simple way to remember it. Frequency is just a fancy word for how many times. Question 3. A BIP stands for A. Behavior Implementation Plan. B. Behavior Intervention Protocol. C. Behavior Intervention Plan. D. Behavioral Improvement Program. Answer: C. Behavior Intervention Plan. This question asks you to identify the correct term that the acronym BIP stands for in ABA. While the other options sound somewhat related, Behavior Intervention Plan is the standard and correct term used by behavior analysts to refer to the detailed guide created to change a specific behavior. This plan outlines strategies for both increasing desired behaviors and decreasing challenging ones. Knowing the correct terminology is important for clear communication with your supervisor and team. Think of it as the client's step-by-step guide for behavior change. Here's a simple way to remember it. BIP is the roadmap for changing behavior. It's the Behavior Intervention Plan. Question 4. Which of the following is an example of a discriminative stimulus, SD? A. A toy a child likes. B. A therapist saying, "Touch your nose." C. A child touching their nose. D. A cookie given after touching their nose. Answer: B. A therapist saying, "Touch your nose." This question is asking you to identify a discriminative stimulus, often called an SD. An SD is a signal or cue that tells you that a specific behavior is likely to be reinforced if you perform it right now. It basically sets the occasion for a behavior. Option A is a reinforcer, if the child likes it and it motivates behavior. Option C is the behavior itself. Option D is the consequence or reinforcer. Saying "touch your nose" is the signal that if the child touches their nose now, they will get a reward. For example, a traffic light turning green is an SD to go, because driving through a green light is reinforced by getting to your destination. Here's a simple way to remember it. An SD is like a green light for a specific behavior. It signals that a reward is available if you act now. Question 5. What is the main purpose of a preference assessment? A. To find out why a challenging behavior is happening. B. To teach a client how to make choices. C. To identify items or activities that may work as reinforcers. D. To measure how often a behavior occurs. Answer: C. To identify items or activities that may work as reinforcers. This question is asking about the goal of a preference assessment. The concept is understanding how we figure out what motivates a client. A preference assessment involves showing a client different things or activities to see which ones they like or prefer. This helps the team choose potential rewards, reinforcers, that are likely to make the client want to learn and use new skills or engage in desired behaviors. It's not about understanding challenging behavior, teaching choice-making specifically, or counting behaviors. For example, you might offer a child blocks, a car, and a book to see which one they reach for or spend time with. Here's a simple way to remember it. Preference assessments are all about finding out what the client enjoys so you can use those things to make learning fun and rewarding. Question 6. If a behavior occurs less often in the future because a stimulus was removed after the behavior, this is called A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer: D. Negative punishment. This question is about the principles of punishment, specifically negative punishment. The keyword removed tells you something is being taken away, and behavior occurs less often tells you the behavior is decreasing. In negative punishment, a desirable item or stimulus is removed after the behavior occurs, and this removal makes the behavior less likely to happen again in the future. Think of negative meaning take away and punishment meaning decrease behavior. Positive reinforcement adds something to increase behavior. Negative reinforcement takes something away to increase behavior, and positive punishment adds something to decrease behavior. For example, taking away a child's video game time, removing a stimulus, because they were hitting their sibling, the behavior, and the hitting then decreases. Here's a simple way to remember it. Negative punishment is like having something good taken away because you did something wrong, making you less likely to do it again. Question 7. When collecting data on how long a behavior occurs, you are measuring A. Frequency. B. Duration. C. Latency. D. Inter-response time, IRT. Answer: B. Duration. This question asks about which measurement method tracks how long a behavior lasts. The keyword how long is your direct clue. Duration is the measurement used specifically for recording the length of time a behavior happens, from its start to its end. Frequency is how many times it happens. Latency is the time between a signal and the start of behavior, and IRT is the time between two occurrences of the same behavior. For example, if a client has a tantrum, you would start a timer when the tantrum begins and stop it when it ends to measure its duration. Here's an easy way to remember it. Duration measures how long the behavior endures. Question 8. What should an RBT do if a client bites them during a session? A. Immediately stop the session and go home. B. Ignore the bite and continue as planned. C. Refer to the client's behavior intervention plan and follow protocol, then document the incident. D. Bite the client back to show them it hurts. Answer: C. Refer to the client's behavior intervention plan and follow protocol, then document the incident. This question addresses a safety and professional conduct issue. An RBT must always prioritize safety while following the established plan and reporting procedures. Option A is not appropriate. Sessions are typically continued if possible following safety procedures. Option B is unsafe and ignores a significant behavior. Option D is never appropriate or ethical. Your BIP likely has a specific protocol for aggression or injury. You must follow those steps precisely to ensure safety and appropriate response, and then it is critical to report the incident and document it thoroughly according to your company's policy and the client's plan. For example, the BIP might say to block the bite and redirect, then document the time and circumstances. Here's a simple way to remember it. When something unexpected or unsafe happens, follow the plan first, make sure everyone is safe, and then tell your supervisor and write everything down exactly as it happened. Question 9. Which prompt is the least intrusive? A. Full physical prompt. B. Partial physical prompt. C. Gestural prompt. D. Verbal prompt. Answer: C. Gestural prompt. This question is about the intrusiveness of prompts, which is important for fading prompts effectively. Intrusiveness refers to how much help you are giving the client. Less intrusive prompts are more subtle and allow the client to do more independently. Full physical is the most help, hand over handy. Partial physical is less, light touch or guidance. Verbal is giving a spoken clue, and gestural is simply pointing or nodding. Pointing, gestural, provides a cue without physically touching or giving a spoken instruction, making it generally less intrusive than physical or verbal prompts. For example, instead of saying touch apple or guiding their hand, you might just point to the apple. Here's a simple way to remember it. Think of it like helping someone. A subtle hint, gestural, is less help than telling them exactly what to do, verbal, or physically guiding them, physical. Question 10. What is the purpose of collecting baseline data? A. To track progress after the intervention starts. B. To determine the function of a behavior. C. To find out how often, long, or intensely a behavior occurs before you start intervention. D. To decide which reinforcers to use. Answer: C. To find out how often, long, or intensely a behavior occurs before you start intervention. This question asks why we collect data before starting a behavior change plan. The concept is baseline measurement. Baseline data is collected to get a clear picture of the behavior before any new teaching or intervention strategies are put in place. This information is crucial because it provides a starting point to compare against later data. It helps the team see if the intervention is actually working by showing if the behavior is changing compared to how it was before. It's not for tracking progress during intervention. That's ongoing data collection. Determining function. That's functional assessment. Or choosing reinforcers. That's preference assessment. For example, if a child calls out in class, you count how many times they call out before you start a new strategy to reduce it. This is the baseline. Here's a simple way to remember it. Baseline is your before picture of the behavior, showing you where you're starting from. Question 11. When should you seek clinical direction from your supervisor? A. Only when you are unsure how to collect data. B. Only when a new challenging behavior occurs. C. When you are asked to do something outside your RBT scope of practice, when the client's behavior changes significantly, or you are unsure about the plan. D. Never. You should figure things out on your own. Answer: C. When you are asked to do something outside your RBT scope of practice, when the client's behavior changes significantly, or you are unsure about the plan. This question is about your professional responsibilities and when to ask for help. As an RBT, you work under supervision, and it's critical to know when to consult your BCBA. You should always seek guidance if you are unsure about how to implement the plan, if the client's behavior suddenly changes, gets worse or much better, or a new behavior appears, or if you are ever asked to do something that doesn't feel right or seems outside of what RBTs are trained to do. Like changing the behavior plan or diagnosing a problem. You should never try to figure out complex issues on your own or ignore significant changes. For example, if a client who rarely showed aggression suddenly starts hitting daily, you must contact your supervisor immediately. Here's a simple way to remember it. When in doubt, reach out. Always ask your supervisor if you're unsure, if something significant changes, or if you're asked to do something you're not trained for. Question 12. Reinforcing every instance of a behavior is called A. Intermittent reinforcement. B. Extinction. C. Continuous reinforcement, CRF. D. Differential reinforcement. Answer: C. Continuous reinforcement, CRF. This question asks about a specific schedule of reinforcement where you reward the behavior every single time it happens. The concept is continuous versus intermittent reinforcement. Continuous reinforcement means that the reinforcer is delivered every single time the target behavior occurs. This is often used when teaching a new skill because it helps the learner quickly understand which behavior leads to a reward. Intermittent reinforcement means you only reward some instances of the behavior. Extinction is withholding reinforcement, and differential reinforcement involves reinforcing some behaviors while withholding reinforcement for others. For example, when teaching a child to touch their nose, you might give a high five every single time they touch their nose correctly at first. Here's a simple way to remember it. Continuous means all the time, so continuous reinforcement means reinforcing the behavior every time it happens. Question 13. Which term describes teaching a client to perform a series of steps in a specific order? A. Shaping. B. Discrimination training. C. Chaining. D. Generalization. Answer: C. Chaining. This question is about teaching complex skills that involve multiple steps. The concept is chaining, which is used for skills that can be broken down into a sequence of smaller teachable steps, like washing hands or getting dressed. You teach the steps in order, one after the other, linking them together like links in a chain, until the client can do the whole sequence independently. Shaping involves reinforcing gradual approximations of a skill. Discrimination training involves teaching the client to respond differently to different signals, and generalization is when a skill happens in new places or with new people. For example, teaching a client to brush their teeth involves a chain of steps. Get toothpaste, put toothpaste on brush, brush front teeth, brush back teeth, rinse, etc. Here's a simple way to remember it. Chaining is like building a chain, one step at a time, to teach a multi-step skill. Question 14. When a previously reinforced behavior stops occurring because the reinforcement is no longer provided, this is called A. Punishment. B. Extinction. C. Generalization. D. Discrimination. Answer: B. Extinction. This question describes the process of extinction. The core idea is that if a behavior used to get a reward, reinforcement, but now it doesn't, the behavior will likely decrease and eventually stop. The keyword "no longer provided" for the reinforcement is the main clue, along with the behavior stopping. Punishment involves adding or removing a stimulus to decrease behavior, but extinction specifically refers to withholding the previously provided reinforcement. Generalization is performing a behavior in new situations, and discrimination is responding differently to different cues. For example, if a child used to cry in the store to get a candy bar, and the parent stops giving candy when they cry, the crying is likely to decrease over time. Extinction. Here's a simple way to remember it. Extinction is when a behavior dies out because it no longer gets the reward it used to get. Question 15. What is the purpose of a functional assessment? A. To determine the best way to teach a new skill. B. To identify the function or purpose of a challenging behavior, why it's happening. C. To see if a client can imitate actions. D. To measure how long a behavior lasts. Answer: B. To identify the function or purpose of a challenging behavior, why it's happening. This question asks about the goal of a functional assessment. The key word functional relates to the function or purpose of the behavior. A functional assessment is the process used to figure out why a challenging behavior is occurring. It helps the team understand what the client is getting from the behavior, what its purpose is for them, example, getting attention, escaping a task, getting a toy, or feeling good/bad sensations. Understanding the function is crucial for creating an effective behavior plan. It's not about teaching skills, imitation, or just measuring duration. For example, a functional assessment might reveal that a child screams, behavior, because they want their parents' attention, function. Here's a simple way to remember it. Functional assessment asks, what's the function? Why is this behavior happening? Question 16. Which of the following is an example of positive reinforcement? A. Taking away a toy because a child yelled. B. Giving a child a sticker for saying please. C. Making a child sit in timeout for hitting. D. Removing a difficult task when a child whines. Answer. B. Giving a child a sticker for saying please. This question is about positive reinforcement. The key concept is adding something to increase a behavior. Positive means adding a stimulus, and reinforcement means the behavior increases in the future. In option B, a sticker, a stimulus, is added after the child says please, the behavior. And if this makes the child say please more often in the future, it is positive reinforcement. Option A is negative punishment, removing something to decrease behavior. Option C is positive punishment, adding timeout to decrease behavior. Option D is negative reinforcement, removing something to increase behavior. Here's a simple way to remember it. Positive reinforcement is like adding a plus, something good, right after the behavior to make that behavior happen more often. Question 17. When writing session notes, what kind of information should you include? A. Only information about challenging behaviors. B. Subjective opinions about the client's mood. C. Objective, observable information about what happened during the session, including behaviors, skills worked on, and data collected. D. Personal feelings about the client's family. Answer. C. Objective, observable information about what happened during the session, including behaviors, skills worked on, and data collected. This question is about proper documentation for RBTs. Session notes are legal documents and must be factual and professional. You should only include information that is objective, based on facts, not feelings, and observable, things you can see or hear. This includes what skills were taught, what behaviors occurred, what data was collected, and any important events. Avoid opinions, personal feelings, or interpretations of why the client did something. For example, instead of writing "client was angry," write "client furrowed eyebrows, clenched fists, and yelled for 30 seconds. Here's a simple way to remember it. Write your session notes like a neutral reporter, sticking only to the facts, what you saw and heard, and what you did. Question 18. Generalization occurs when a client performs a skill. A. Only in the specific situation where it was taught. B. In new settings with new people or using new materials. C. Without any prompting. D. Only when a specific SD is presented. Answer. B. In new settings with new people or using new materials. This question asks about generalization. The concept is whether a skill learned in one specific situation carries over to other situations. Generalization is when the client can use the skill they learned in different places, with different people, with different instructions, or using different items than they were originally taught with. This is a key goal in ABA. We want skills to be useful in the real world, not just during therapy sessions. Option A describes the opposite of generalization. Options C and D relate to independence and stimulus control, but not necessarily applying the skill more broadly. For example, if a child learns to say ball when shown a specific red ball with their RBT, generalization is saying ball when they see a blue ball, a basketball, or a picture of a ball, or saying it with their parent or teacher. Here's a simple way to remember it. Generalization is when a skill spreads out and works in lots of different situations beyond where it was first learned. Question 19. Which of the following is not a function of behavior? A. Attention. B. Escape. C. Automatic, sensory. D. Confusion. Answer. D. Confusion. This question is about the four main functions of behavior that are commonly assessed in ABA. Functional assessment helps determine why a behavior is happening, and behaviors typically serve one of these four purposes: to get attention from others, to escape or avoid something unpleasant, to get access to tangible items or activities, or because it feels good or meets a sensory need. Automatic. Confusion is not considered a function that maintains behavior. While confusion might precede a behavior, it's not what the behavior gets for the person to make it happen again. For example, a child might tantrum to get attention, to avoid doing homework, escape, to get a cookie, tangible, or because rocking back and forth feels good, automatic. Here's a simple way to remember it. Think of the 4 reasons someone does something. Access, escape, attention, sensory. Use the acronym SEED, or tangible, escape, attention, sensory, tease. Confusion isn't one of the main seats at the table. Question 20. When implementing a skill acquisition plan, you should first: A. Collect data on the skill for 1 week. B. Review the plan and prepare your materials. C. Immediately begin prompting the client. D. Ask the client what they want to learn. Answer: B. Review the plan and prepare your materials. This question is about the steps involved in implementing a teaching plan. Before you start teaching any new skill, it's essential to understand exactly what you are supposed to do. This means carefully reading and understanding the skill acquisition plan provided by your supervisor. You need to know the goal, the steps, the materials needed, the prompting strategy, and the data collection method. After reviewing the plan, you gather any necessary materials so you are ready to go. You wouldn't just jump in, collect data for a week without a plan, immediately prompt without knowing the strategy, or just ask the client what they want, unless directed by the plan as part of a choice procedure. For example, if the plan is to teach toothbrushing, you'd read the steps, gather a toothbrush, toothpaste, and cup, and then start the session. Here's a simple way to remember it. Always know your plan and have your tools ready before you start building a new skill. Question 21. Which type of data collection involves marking if a behavior occurred at any point during a specific interval? A. Momentary time sampling. B. Partial interval recording. C. Whole interval recording. D. Frequency. Answer: B. Partial interval recording. This question asks about a specific method of discontinuous measurement. The keywords are any point and interval. In partial interval recording, you divide the observation time into short intervals, example, 10 seconds. If the behavior happens at any time during that 10-second interval, you mark it as occurring for that interval, even if it only happened for a second. Momentary time sampling is only if it happens at the very end of the interval. Whole interval recording is only if it happens for the entire duration of the interval. Frequency is just counting occurrences. For example, if you're tracking calling out in a classroom using 1-minute intervals, and the child calls out for 5 seconds during that minute, you'd mark yes for that 1-minute interval using partial interval recording. Here's a simple way to remember it. In partial interval, if the behavior happens even for a partial bit of the interval, you mark it. Question 22. What should an RBT do if they are asked to work with a client they are related to? A. This is acceptable as long as they are paid. B. This is a potential conflict of interest and should be discussed with the supervisor. C. It is fine as long as the client is a distant relative. D. Accept the case but do not tell the supervisor. Answer: B. This is a potential conflict of interest and should be discussed with the supervisor. This question is about maintaining ethical boundaries and professional conduct. Working with family members or close friends can create a dual relationship or conflict of interest, which can negatively impact professional judgment and the client's best interest. RBTs have an ethical obligation to avoid these situations. If asked, you must inform your supervisor immediately so they can make an appropriate decision, which would likely involve assigning a different RBT to the case. Accepting without telling the supervisor is unethical. For example, if your cousin's child is assigned to your caseload, you must report this relationship to your supervisor right away. Here's a simple way to remember it. Keep your professional life and your personal life separate, and always report any relationship that could be a conflict to your supervisor. Question 23. A prompt should be delivered. A. After the client responds incorrectly. B. At the same time as the SD or just after the SD. C. After the reinforcer is delivered. D. Only when the client refuses to respond. Answer B. At the same time as the SD or just after the SD. This question is about the timing of delivering prompts. The purpose of a prompt is to help the client respond correctly when the signal, SD, is given. Therefore, the prompt needs to happen either at the exact moment the SD is presented or immediately following the SD, before the client has a chance to respond incorrectly or not respond at all. Delivering prompts at other times won't effectively guide the correct response linked to the SD. For example, if you are teaching a child to touch blue, when you say touch blue, you would say touch blue, SD, and immediately point to the blue object, prompt, to help them get it right initially. Here's a simple way to remember it. Prompts go right after or with the signal, SD, to guide the correct response before the client can make a mistake. Question 24. What is the difference between positive and negative in the terms positive/negative reinforcement and positive/negative punishment? A. Positive means good and negative means bad. B. Positive means adding a stimulus and negative means removing a stimulus. C. Positive means increasing behavior and negative means decreasing behavior. D. Positive means preferred and negative means non-preferred. Answer B. Positive means adding a stimulus and negative means removing a stimulus. This question clarifies the specific meaning of positive and negative in the context of ABA principles. These terms do not mean good or bad. In ABA, positive always means you are adding or presenting something after a behavior occurs. Negative always means you are removing or taking something away after a behavior occurs. The terms reinforcement and punishment tell you if the behavior is increasing or decreasing. For example, positive reinforcement adds a sticker, negative reinforcement removes a chore, positive punishment adds a reprimand, negative punishment removes a toy. Here's a simple way to remember it. Positive is plus, plus, adding something, and negative is minus, removing something. Question 25. Which data collection method is best suited for behaviors that happen continuously or for long periods, like humming or rocking? A. Frequency. B. Duration. C. Latency. D. Momentary time sampling. Answer B. Duration. This question asks about the best way to measure behaviors that don't have a clear start and stop or happen constantly. The keyword continuously or for long periods points to duration measurement. Frequency is best for behaviors with a clear beginning and end that happen relatively quickly. Latency measures the time before a behavior starts, and momentary time sampling only captures if it happens at a specific moment. If a behavior like humming goes on and on, counting it is hard, but timing how long it lasts is a precise way to measure it. For example, you would use a stopwatch to measure how long a child engages in hand flapping. Here's an easy way to remember it. If you can easily time the behavior with a stopwatch from start to finish, duration is probably the best measurement. Question 26. When fading prompts, you should move from A. Less intrusive prompts to more intrusive prompts. B. More intrusive prompts to less intrusive prompts. C. Verbal prompts to physical prompts. D. Physical prompts to verbal prompts. Answer B. More intrusive prompts to less intrusive prompts. This question is about the process of prompt fading, which is essential for helping clients become independent. The goal of prompting is to help the client get the response right at first, but then you need to fade the prompts away so they can perform the skill on their own when the SD is presented. To do this, you start with a prompt that provides enough help, which might be more intrusive, like physical guidance, and gradually move to prompts that provide less help, less intrusive, like a gesture or just waiting longer, until no prompt is needed. For example, when teaching hand washing, you might go from full physical guidance to light touch guidance to pointing to no prompt. Here's a simple way to remember it. Fade prompts from more help to less help so the client can eventually do it independently. Question 27. What is the purpose of collecting interim server agreement, IOA? A. To train new RBTs. B. To check the reliability or consistency of the data being collected. C. To determine the function of a behavior. D. To assess client preference for items. Answer B. To check the reliability or consistency of the data being collected. This question asks about interim server agreement, or IOA. The concept is data reliability, making sure the data is accurate. IOA is when two independent observers, like two RBTs or an RBT and a supervisor, collect data on the same behavior at the same time for the same client. Then they compare their data. If their data matches a high percentage of the time, it means the data collection method is reliable and the data is likely accurate. If their data doesn't match, it shows the data isn't reliable and maybe the definition of the behavior isn't clear or the RBT needs more training on data collection. For example, two RBTs might both count instances of hitting during the same 10-minute period and compare their counts. Here's an easy way to remember it. IOA is like having two people check the same work to make sure the data is reliable and accurate. Question 28. When should you report a potential ethical violation or concern? A. Only if you are directly involved in the violation. B. Only if your supervisor tells you to. C. Immediately, according to your company's policy and the BACB's guidelines. D. After discussing it with other RBTs first. Answer C. Immediately, according to your company's policy and the BACB's guidelines. This question is about your ethical responsibility to uphold the RBT Code of Conduct. If you witness or suspect any behavior that goes against ethical standards or could harm the client, like a colleague being neglectful or a supervisor asking you to do something unethical, you have a responsibility to report it. You should follow your company's specific reporting procedures and the guidelines set by the BACB, Behavior Analyst Certification Board, which often involves reporting to your supervisor, their supervisor, or even the BACB itself if necessary. You should not ignore it, wait to be told, or just gossip with colleagues. For example, if you see an RBT physically harming a client, you must report it immediately through the proper channels. Here's a simple way to remember it. If you see something that seems wrong or unethical, speak up and report it right away using the correct procedures. It's your responsibility to protect the client and the field. Question 29. A task analysis is used to A. Identify the function of a behavior. B. Break down a complex skill into smaller, manageable steps. C. Determine the best reinforcer for a client. D. Measure the intensity of a behavior. Answer B. Break down a complex skill into smaller, manageable steps. This question asks about the purpose of a task analysis. The key term task analysis literally means analyzing a task. It's the process of taking a skill that has multiple steps, like brushing teeth or making a sandwich, and breaking it down into each individual step that needs to be completed in order. This makes teaching complex skills much easier because you can teach one step at a time using chaining procedures. It's not used for functional assessment, preference assessment, or measuring behavior intensity. For example, a task analysis for washing hands might list 1. Turn on water. 2. Wet hands. 3. Get soap. 4. Rub hands together for 20 seconds. 5. Rinse hands. 6. Turn off water. 7. Dry hands. Here's a simple way to remember it. A task analysis is like writing down a recipe for a skill, breaking it into bite-sized steps. Question 30. What is it called when you provide reinforcement for a behavior that is not the challenging behavior, while withholding reinforcement for the challenging behavior? A. Extinction. B. Punishment. C. Differential reinforcement. D. Prompting. Answer C. Differential reinforcement. This question describes the core concept of differential reinforcement, which is a common and effective behavior reduction strategy. Differential means different. You are reinforcing one behavior, an appropriate alternative, or simply the absence of the challenging behavior, and withholding reinforcement for the challenging behavior. There are different types, like DRO, DRA, DRI. But the general idea is that you are reinforcing differentially. Some behaviors get reinforcement, and the target challenging behavior does not. Extinction is only withholding reinforcement. Punishment involves adding or removing a stimulus to decrease behavior. Prompting is helping a client perform a skill. For example, if a child calls out for attention, you might reinforce them raising their hand quietly, DRA, and ignore them when they call out, extinction of calling out. Here's a simple way to remember it. Differential reinforcement is like saying yes to this behavior, no reinforcement for that behavior, making the desired behavior more likely. Question 31. When must an RBT work under the supervision of a BCBA or BCABA? A. Only when implementing behavior reduction plans. B. Only when teaching new skills. C. When providing services that are based on the principles of ABA. D. Only during the first few months of employment. Answer: C. When providing services that are based on the principles of ABA. This question is about the requirement for RBT supervision. A fundamental requirement for RBTs is that all services you provide that are based on the science of applied behavior analysis must be under the direct supervision of a certified BCBA or BCABA. You are not allowed to practice ABA independently. This ensures you are implementing plans correctly, receiving guidance, and maintaining ethical standards. This applies to all ABA services, whether it's skill acquisition, behavior reduction, or data collection, and is required throughout your time as a practicing RBT, not just when you are new. For example, you cannot decide on your own to start a new teaching program with a client. Your supervisor must create the plan and oversee your implementation. Here's a simple way to remember it. Think of your supervisor as your captain. You must always be working under their direction when doing anything related to ABA services. Question 32. Which type of data collection involves checking if a behavior is occurring at the very end of a specific interval? A. Partial interval recording. B. Whole interval recording. C. Frequency. D. Momentary time sampling. Answer: D. Momentary time sampling. This question describes another type of discontinuous measurement. The key phrase is very end of the interval. In momentary time sampling, you divide the observation time into intervals, but you only look up and record whether the behavior is happening exactly when the interval ends. If it was happening just before or starts just after the buzzer, you don't record it. This method is often used in classroom or group settings, as it's easier to manage while supervising multiple individuals. For example, if you set a timer for 5 minutes, you only check if the behavior, like on-task behavior, is happening the moment the timer beeps at the end of each 5-minute interval. Here's an easy way to remember it. Momentary means just at that moment, so you only look at the behavior at the exact moment the interval finishes. Question 33. What is the primary goal of pairing yourself with reinforcement? A. To teach the client new skills quickly. B. To become a reinforcing presence for the client. C. To reduce challenging behaviors immediately. D. To assess the client's preferences. Answer: B. To become a reinforcing presence for the client. This question asks about the important initial step of pairing. Pairing is when you associate yourself with things the client already likes. Reinforcers. You spend time delivering preferred items, activities, and praise without making demands. The goal is for the client to associate you with good things, so that eventually your presence, your attention, and working with you become reinforcing in themselves. This helps build rapport and makes the client more motivated to engage with you and the learning process. It's not primarily about teaching skills quickly or reducing behavior instantly, though those might be later effects once pairing is successful. Preference assessments help you find what to pair with, for example, spending time playing with a child using their favorite toys before asking them to do any tasks. Here's a simple way to remember it. Pairing means linking yourself with good stuff so the client thinks, Being with this person is awesome. Question 34. An RBT should communicate with a client's family members. A. Only about the client's progress. B. Only about scheduling. C. Only if the family member initiates the conversation. D. As authorized by their supervisor, following the communication plan. Answer: D. As authorized by their supervisor, following the communication plan. This question addresses ethical and professional communication boundaries for RBTs. RBTs have limitations on what information they can share and how they should communicate with a client's family. All communication about the client's program, progress, or behavior should be cleared and often guided by your supervisor. Your supervisor will establish a communication plan detailing what you can discuss with the family, often limited to session activities, behavior incidents you documented, and potentially scheduling if that's your role, and what topics the supervisor will handle. Sharing information about the client's program or progress without supervisor authorization can violate confidentiality and scope of practice. For example, you might be allowed to tell a parent, "We worked on matching shapes today, and John matched 8 out of 10, but you would refer questions about why matching shapes is a target or how the overall program is designed to your supervisor. Here's a simple way to remember it. When talking to families about the client, stick to what your supervisor has cleared you to say and always direct bigger questions to them. Question 35. Which measure tracks the time between the end of one instance of a behavior and the start of the next instance of the same behavior? A. Latency. B. Duration. C. Interresponse time, IRT. D. Frequency. Answer: C. Interresponse time, IRT. This question asks about a specific time-based measurement. The key phrase is time between the end of one instance and the start of the next instance of the same behavior. This is the definition of interresponse time, IRT. Latency is the time between a signal and the start of the behavior. Duration is how long the behavior lasts. Frequency is the count. IRT is used when you want to increase or decrease the spacing between behaviors. For example, if a client asks for help too often, you might measure the IRT between requests for help and reinforce longer IRTs, waiting longer before asking again. Here's a simple way to remember it. IRT is the interval between responses, the quiet time between 2 times the behavior happens. Question 36. When delivering a reinforcer, it is important to A. Deliver it several minutes after the behavior occurs. B. Deliver it immediately after the target behavior. C. Make the client work for it for a long time. D. Use the same reinforcer every time. Answer: B. Deliver it immediately after the target behavior. This question is about the effective delivery of reinforcement. For reinforcement to be most effective, it needs to be delivered as soon as possible after the desired behavior occurs. This helps the client clearly understand which specific behavior earned the reward. A delay in delivery makes it hard for the client to make the connection between their action and the consequence, potentially reinforcing a different behavior that happened during the delay. For example, if a child says "ball," when you show them a picture of a ball, you should give the sticker or praise right away, not a minute later. Using the same reinforcer every time can lead to the client getting tired of it, satiation, and making them wait a long time is not effective reinforcement delivery. Here's a simple way to remember it. Strike while the iron is hot. Deliver the reward right after the behavior so the client knows exactly what earned it. Question 37. What is the definition of a behavior? A. Something a person says or does. B. How a person feels or thinks. C. A person's personality. D. A medical diagnosis. Answer: A. Something a person says or does. This question asks for the definition of behavior from an ABA perspective. In ABA, behavior refers to anything an organism does that is observable and measurable. This includes things people say, verbal behavior, and things people do, motor behavior, feelings, thoughts, and personality traits are not directly observable and measurable in the same way, so while they are important, they are not considered behaviors themselves in this context. A medical diagnosis describes a condition, not the actions of a person. For example, walking, talking, crying, smiling, hitting, writing. These are all behaviors. Here's a simple way to remember it. If you can see it or hear it, it's probably a behavior. Question 38. Which prompting strategy involves providing the strongest prompt needed at first, and then systematically fading it to less intrusive prompts as the learner is successful? A. Least to most prompting. B. Most to least prompting. C. Time delay. D. Stimulus fading. Answer: B. Most to least prompting. This question asks about a specific prompting strategy. The description strongest prompt needed at first, and then systematically fading it to less intrusive prompts, perfectly describes most to least prompting. You start with the prompt that guarantees success, often a physical prompt, and gradually reduce the level of assistance on subsequent trials as the learner starts to master the skill. Least to most prompting starts with the least intrusive prompt and only moves to more intrusive prompts if the learner makes an error. Time delay involves waiting before providing a prompt. Stimulus fading involves gradually changing a feature of the material or SD. For example, teaching a child to write their name might start with hand-over-hand guidance, most intrusive, and move to tracing, then dots, then no prompt. Here's a simple way to remember it. Most to least starts with the most help and fades down to the least help. Question 39. When using a DRO, differential reinforcement of other behavior, procedure you reinforce the client for. A. Engaging in a specific alternative behavior. B. Completing a task quickly. C. Not engaging in the challenging behavior for a specific amount of time. D. Engaging in a high rate of a desired behavior. Answer: C. Not engaging in the challenging behavior for a specific amount of time. This question is about one specific type of differential reinforcement, DRO. In DRO, you set a timer, an interval. If the challenging behavior does not occur at any time during that interval, the client earns a reinforcer when the interval ends. If the challenging behavior does occur during the interval, you reset the timer and do not deliver reinforcement for that interval. You are reinforcing the absence of the target behavior or any other behavior besides the target behavior. Option A describes DRA or DRI. Options B and D relate to speed or rate of a desired behavior, sometimes addressed with DR date or DRL. For example, if a child frequently yells, you might reinforce them with a sticker if they don't yell for a 5-minute interval. Here's a simple way to remember it. DRO means you are reinforcing 0 occurrences of the problem behavior within a time period. Question 40. Confidentiality means: A. You can share client information with anyone in your company. B. You should only discuss client information with the client's family. C. Protecting the client's private information and only sharing it with authorized people on a need-to-know basis. D. You should not take any data on client behavior. Answer: C. Protecting the client's private information and only sharing it with authorized people on a need-to-know basis. This question is about client confidentiality, a critical ethical standard. Confidentiality means keeping a client's information private. You are entrusted with sensitive information about the client and their family, and you must protect it. This means you only discuss the client's information with members of the clinical team, your supervisor, other RBTs, or BCBAs working on the case, who need that information to do their job effectively, and you must have proper authorization to share information with anyone outside the team, like family members. As discussed in question 34, you certainly don't share it with everyone in the company or just the family, and confidentiality does not mean you don't collect data. Data is part of the client's record, which must be kept confidential. For example, you wouldn't talk about your client's therapy session at the grocery store or post about it on social media. Here's a simple way to remember it. Keep client information private. Only share what's necessary with people who need to know and with permission from your supervisor. Question 41. An RBT's session notes should be A. Written only if something significant happened. B. Completed at the end of the week. C. Completed as soon as possible after the session, accurately and objectively. D. Written from memory a few days later. Answer. C. Completed as soon as possible after the session, accurately and objectively. This question is about the proper procedure for completing documentation. Session notes are important records of the services provided and the client's progress. They need to be accurate and reflect what actually happened. Writing them immediately or as soon as possible after the session ensures the details are fresh in your mind, making the notes more accurate. Waiting too long means you might forget important details. Notes should be completed after every session, not just when something significant happens, and they must be objective, fact-based, not written days later from memory, which can be unreliable. For example, immediately after a session, you would write down the program's run, the data collected, and any observed behaviors or relevant events. Here's a simple way to remember it. Write your notes right after the session while you still remember everything clearly and accurately. Question 42. When teaching a skill using discrete trial training, DTT, what is the typical sequence of events in one trial? A. Reinforcer, greater than response, greater than SD. B. Response, greater than SD, greater than reinforcer. C. SD, greater than response, greater than consequence. Reinforcement or error correction. D. Consequence, greater than SD, greater than response. Answer. C. SD, greater than response, greater than consequence. Reinforcement or error correction. This question asks about the basic structure of a single trial in discrete trial training, a common teaching method in ABA. DTT breaks skills into small steps and teaches them individually. Each trial has a clear beginning and end. The sequence is 1. The discriminative stimulus, SD, is presented, the instruction or cue. 2. The client provides a response. 3. A consequence follows, which is either reinforcement if the response was correct, or an error correction procedure if the response was incorrect. For example, the therapist says, touch red, SD. The client touches red, response. And the therapist says, that's right, and gives a high five, consequence, reinforcement. Here's a simple way to remember it. A DTT trial is like a mini lesson with a clear start, instruction, the client's try, response, and what happens next, consequence. Think SD, greater than response, greater than consequence. Question 43. What should you do if a client's parent asks you to babysit for them? A. Accept as it helps build rapport. B. Decline as this creates a dual relationship and blurs professional boundaries. C. Accept but make sure your supervisor approves. D. Accept but charge a higher rate than your RBT pay. Answer. B. Decline as this creates a dual relationship and blurs professional boundaries. This question relates to maintaining professional and ethical boundaries. Accepting offers like babysitting, friendships, or business relationships with a client's family creates a dual relationship where you have both a professional and personal role with them. This is unethical because it can compromise your professional judgment, objectivity, and the effectiveness of therapy, putting the client's best interest at risk. RBTs must avoid dual relationships. You should politely decline such requests and, if necessary, discuss it with your supervisor. Asking your supervisor for approval doesn't make an unethical situation ethical. For example, if a parent invites you to their child's birthday party, you would politely decline and explain that RBTs must maintain professional boundaries. Here's a simple way to remember it. Keep your professional life separate from personal relationships with client families to protect everyone involved. Question 44. When collecting frequency data, you would use this method for behaviors like A. Reading a book. B. Having a tantrum. C. Hand raising. D. sitting appropriately. Answer C. Hand raising. This question asks about which type of behavior is best measured using frequency. Frequency is used to count behaviors that have a clear start and stop and are relatively brief and distinct. Behaviors like reading a book or sitting appropriately often happen for longer periods or continuously, making duration or interval recording more suitable. A tantrum can vary greatly in length, so duration is often a better measure, although frequency could be used if you want to count how many tantrums occurred. Hand raising, however, is a discrete event that is easily counted each time it happens. For example, if a child raises their hand 5 times during a lesson, you can easily count and record 5 as the frequency. Here's a simple way to remember it. If you can easily put a quick tally mark down each time the behavior happens, frequency is probably the right choice. Question 45. What is the purpose of generalization training? A. To teach the client new skills faster. B. To ensure skills learned in therapy can be used in everyday life situations. C. To reduce challenging behaviors. D. To identify what motivates the client. Answer B. To ensure skills learned in therapy can be used in everyday life situations. This question asks about the goal of generalization training. Generalization is making sure a skill isn't stuck in the therapy room. Generalization training involves specifically planning and teaching for the skill to occur in different environments, with different people, at different times, or with different materials than were used in the original teaching. This is crucial for clients to be able to use their new skills effectively in their home, school, or community. It's not about speeding up skill acquisition, reducing challenging behaviors, though it can sometimes have that effect indirectly, or finding reinforcers. For example, teaching a client to order food at multiple different restaurants, not just the pretend one in the clinic. Here's a simple way to remember it. Generalization training helps learned skills go global and work in the real world. Question 46. When working with a client, you should always A. Follow your instincts and do what feels right. B. Follow the individualized behavior change plan developed by your supervisor. C. Try new techniques you read about online. D. Let the client decide what activities you do. Answer B. Follow the individualized behavior change plan developed by your supervisor. This question is about your primary responsibility as an RBT. Your role is to implement the specific plan created for the client by the BCBA or BCABA supervisor. This plan is designed based on assessment data and the principles of ABA, tailored specifically to that client's needs. You should not deviate from the plan, make up strategies, use unproven techniques, or simply let the client dictate the session activities, unless the plan includes client choice. Your supervisor relies on you to implement the plan consistently and correctly. For example, if the plan says to use a gestural prompt, you must use a gestural prompt, not a physical one, unless directed otherwise by your supervisor. Here's a simple way to remember it. Your plan is your guide. Always follow the specific instructions given by your supervisor for that client. Question 47. What is the definition of an antecedent? A. What happens immediately after a behavior? B. The behavior itself. C. What happens immediately before a behavior? D. A consequence that increases behavior. Answer C. What happens immediately before a behavior? This question asks about a key term in the ABC model, antecedent behavior consequence. The antecedent is what happens right before the behavior occurs. It's the event, stimulus, or situation that sets the stage for the behavior. Understanding antecedents helps us predict when a behavior is likely to happen and can inform strategies to prevent challenging behaviors or set up opportunities for desired ones. The consequence is what happens after the behavior. The behavior is the action itself. Reinforcement is a type of consequence. For example, the doorbell rings, antecedent, you walk to the door, behavior, you open the door, consequence. Or the teacher says, time for math, antecedent, the child yells, no, behavior, The teacher removes the math sheet. Consequence: potentially escape. Here's a simple way to remember it. Antecedent is the A in ABC. It comes before the behavior. Question 48. When collecting data using whole interval recording, you mark the behavior as occurring only if it happens. A. At any point during the interval. B. At the very end of the interval. C. For the entire duration of the interval. D. More than a certain number of times during the interval. Answer: C. For the entire duration of the interval. This question asks about another discontinuous measurement method. In whole interval recording, you divide the observation time into intervals. You only mark that the behavior occurred for that interval if it happened continuously for the entire length of the interval. If the behavior stops even for a moment during the interval, you do not mark it. This method often underestimates the occurrence of a behavior. Option A describes partial interval, and option B describes momentary time sampling. For example, if you are tracking on-task behavior using 1-minute intervals, you only mark yes if the client was actively engaged in the task for the full 60 seconds of that interval. Here's an easy way to remember it. In whole interval, the behavior has to happen for the whole interval to be counted. Question 49. Which ethical guideline is about being truthful and honest? A. Maintaining professional boundaries. B. Confidentiality. C. Integrity. D. Client dignity. Answer: C. Integrity. This question asks about a core ethical principle in the RBT Code of Conduct. Integrity means being honest, truthful, and accurate in all your professional activities, including documentation, communication with supervisors, and providing services. It's about being reliable and trustworthy. Maintaining boundaries is about professional relationships, confidentiality is about protecting privacy, and client dignity is about respecting the client's rights and treating them with respect. Having integrity means you accurately report data, even if it doesn't show the progress you hoped for, and you are honest about any mistakes you make. Here's a simple way to remember it. Integrity is about being honest and having strong moral principles in your work. Question 50. What is the definition of an operant behavior? A. A behavior that is involuntary and elicited by a stimulus. B. A behavior that is controlled by its consequences. C. A behavior that only occurs in response to a specific command. D. A behavior that is aggressive. Answer: B. A behavior that is controlled by its consequences. This question introduces the fundamental concept of operant behavior in ABA. Operant behaviors are voluntary actions that are influenced by what happens after they occur, their consequences. If a behavior is followed by a reinforcing consequence, it's more likely to happen again in the future. If it's followed by a punishing consequence, it's less likely to happen again. This is the core principle behind reinforcement and punishment. Option A describes responded behavior, like blinking when something gets in your eye. Options C and D describe specific types or contexts of behavior, but not the underlying principle of how consequences influence voluntary actions. For example, raising your hand in class is an operant behavior because whether you do it again depends on the consequence. Example, you get called on or you get ignored. Here's a simple way to remember it. Operant behaviors are the ones we learn to do or not do based on what happens right after we do them